Let's turn now to the Midwest. Michigan ranked third in the number of COVID-19 deaths last week. Most new cases of the virus are in and around the city of Detroit, where hospitals are nearing 90% capacity. Joining us now is Detroit Mayor Mike Duggan. Good morning to you, Mr. Mayor.
Thanks for having me on, Margaret.
What's driving the infections, and what do you expect to see over the next few weeks?
Well, the numbers you're showing are the area. The city of Detroit is the illustration of what Dr. Birx just said. She's been to my office, and we spent time at this, but Detroit actually has the lowest infection rate in the state of Michigan. We're half of that of the surrounding suburbs. And it's because behavior changed. In March and April, Michigan was hammered along with New York, and we had, within a few weeks, 1,000 people hospitalized and 50 of our neighbors dying every day. Today, we've got about 200 hospitalized, and we're losing 1 or 2 people a day to COVID. It's still too high, but the commitment to the testing, the commitment to the masks has shown that you can dramatically drop the infection rate.
When you say behavior changed, you have a mask mandate. What's changed?
Well, in March and April, we didn't know. Certainly, people in Detroit took to heart the data that showed if an African American gets COVID, you've got a 2 to 3 times more likely chance to die than a Caucasian. And so in Detroit, assembly lines are in our DNA. We set up the biggest and most efficient drive-through testing site in the Midwest at the fairgrounds. We were testing 1,000 to 1,200 people a day. And all summer and into the fall, if you drove around the city, Detroiters were wearing masks. It was not necessarily true in the surrounding communities, and the governor has made this point repeatedly, but literally in Detroit, we have an infection rate less than half that of the surrounding suburbs. If you make the commitment to the masks, we don't have to shut the economy of this country down, but it means you have to do it. It isn't that hard.
You were a hospital CEO before you became mayor. There are several health systems in the state of Michigan where reportedly they're telling hospital workers to come to work even if they've had close contact with a loved one who has COVID-19. How bad are the staffing shortages at your local hospitals?
Again, in the city of Detroit, we're in good shape. As I indicated, in April, we have 1,000 people hospitalized. Today, 200 in the city. Now, you go outside to the suburbs, it's a different situation. And so now we're very much focused on the vaccinations. And I was on a call with a number of mayors with President-elect Biden, who made the point there's a big difference between vaccines and vaccinations. And we're looking now at the reality that when we were testing 1,200 people a day, that was a major undertaking. To get the vaccinations out, we're going to have to vaccinate 5,000 a day just in Detroit. And this country is not yet geared up. And so to me, people saying vaccines are coming, are coming, we haven't begun as a country to address what it's going to take to actually inject people with the vaccine.
No, it's a fair point, and it's ultimately going to be up to the state governors to execute on that. So what do you know about the state of Michigan and what's going to happen in your city?
Well, Governor Whitmer's been terrific from the beginning, but the direction we're getting from Washington is changing literally by the day. But we know in Detroit, we're going to take our convention center, we're going to take the parking structures around our football and baseball stadiums, because when we were doing the huge testing in the summer, you had good weather. You can't do wholesale vaccinations in January, February, and March out in snowstorms. And so we're probably going to take all of the major parking structures, and as soon as the vaccines are available, January or February, we're going to gear up, and we intend to vaccinate 5,000 a day. We know the pharmacies are going to be helpful, the doctors and hospitals will be helpful, but the magnitude of what we're talking about, this country has never experienced. And basically right now, we're day and night getting ready for wholesale vaccinations.
You talked about how disproportionately hard African Americans in particular have been by this virus. In your city, in your opinion, who do you think should be prioritized? Should you prioritize people based on their demographics? Should you prioritize them based on their occupation?
Well, I think we're going to, certainly occupation is going to go first, and what the feds are talking about now is hospital workers going first, then EMTs, police officers, firefighters, and the like. And then I think people over the age of 65. The death rate on people over 65 is so much higher than those who are younger. That's the way they're talking about it. I will be really glad when Joe Biden takes control of this, and we get clear direction. But we will follow whatever protocols are there. You think about the city of Detroit with 700,000 people. If you were able to vaccinate 5,000 a day, you're still talking 3 or 4 months. And that's the same challenge everybody in the country's got.
Right. And we will be covering it. Thank you very much, Mr. Mayor.